Hi doctors, I have a question for you. I do a lot of cooking, especially spicy Asian food, and whenever I eat green peppers or the spicy chilies especially, I get some heartburn and a real dryness in my throat area. So I've tried everything just about, and I was wondering if you had any suggestions for a new procedure or something that I could try to keep that from coming back.
We have Dr. Kevin Reavis to help answer Lila's question. He's a gastrointestinal surgeon from UCI Medical Center in Irvine, California. Welcome to the show.
Welcome. Kevin, we get this question all the time. We want to hear the ins and outs about acid reflux, okay?
Acid reflux, by definition, is the acid in your stomach washing up into your esophagus, creating that heartburn symptom that Lila was complaining about at home.
Which is so common. A lot of people have it, but it's from time to time. Nothing that you have to worry about, nothing to have to change your lifestyle. But she's suffering from it all the time.
When medicines are not able to completely take care of the situation, or patient's situation basically is poorly controlled with medication, some of the procedures we can do involve new endoluminal treatments if they're not so severe that they require formal surgery.
This is a relatively new procedure, the esophagus.
That's correct. This is the device here. And it basically is inserted over a flexible endoscope, which I'll show here, which has a camera on the tip that allows me to look around on the inside of an individual patient's stomach and guide the procedure. The esophagus device then deploys these fasteners, which are absolutely key to the procedure which takes place on the inside. The ideal candidate would be someone whose acid reflux is poorly controlled with medication, but it's not so severe that they require formal surgery.
Can you show us how this works?
So the device is inserted with the endoscope in place into the patient's mouth. And as you can see on the animation, the device is placed in the mouth, down the esophagus, into the stomach. The camera is allowed to look around and make sure that we're in the appropriate location, and then the esophagus device grabs a small portion of the stomach and pulls it down. This creates a valve. The fasteners are then deployed and creates a new one-way valve from the esophagus into the stomach, as you can see here, so that swallowed contents go down into the stomach and they stay there rather than washing back up into the esophagus and create the heartburn symptoms we talked about.
So a great option, and once you have this, hopefully from that point forward, you're not going to need any more treatment with medications, correct?
So the goal is for patients who either don't tolerate medication or they don't want to be on medication for the rest of their life. This is a potential treatment option.
Well, thank you so much for sharing this new technology with us. We appreciate it. Coming up, are you having trouble sleeping at night? Well, the cure may be much simpler than you could have ever imagined. And later, don't miss the amazing results of our airbrush makeup makeover. All that and more next.